everyone. I'm Molly Lindquist, part of the MantaCares team, and I want to welcome you to our Patient from Hell podcast club. The purpose of the Patient from Hell PCORI episodes, funded by the Patient-Centered Outcomes Research Institute, is to bring PCORI-funded researchers onto the podcast to share about their research so more of us can learn about it and use it to help us in our own lives as patients or care partners. Today, I'm super excited to introduce our nonprofit partner organization, Men's Health Network. We're going to speak with Dr. Sal Giorgianni about his work with the organization, his personal experience with prostate cancer, as well as his response to the latest episode in our PCORI series, episode 37, Decoding Decision-Making in Prostate Cancer with Dr. David Penson of Vanderbilt University. Dr. Giorgianni is the Senior Science Advisor to the Men's Health Network. He's also Chair Emeritus and co-founder, American Public Health Association Men's Health Section, and past board member, Columbia University School of Public Health Alumni Association. Dr. Giorgianni is the author and co-author of over 120 peer-reviewed and general audience articles and scientific presentations on the comprehensive health of boys and men, with a focus on the impact of U.S. culture, advertising, and marketing on male attitudes towards healthcare and self-care. Dr. Giorgianni, wow, it's a pleasure to have you here today. Thank you so much for taking the time to chat with us. I'd love to hear about your any additional background you'd like to provide. And then I know you've had a personal experience with prostate cancer. So if you wouldn't mind just telling us how that experience has been for you, that would be fantastic.
Well, again, thanks for having us on, and thanks for inviting Men's Health Network to work with you in your work. I guess the most important thing I could add on to that rather long list that I'm sure my mom wrote for you is that I'm a guy. And just like all guys, I worry about prostate cancer and general health. And probably in my 30s, I wasn't as cautious or aware of my health needs in my 60s and now my 70s as I should have been. So I probably, if I had to live it all over again, next life as a guy, I do things a little bit differently. But I think the most important thing is that I want to stress that I do this for a passion and I do this for a living. I provide healthcare counseling, but when I was confronted with the idea that I might have prostate cancer, I was scared, I was confused, I went blank, and I had to go through all of the emotional ups and downs that my patients had to go through, or people I work with had to go through, and people that I advocate for had to go through. So I think maybe my own personal story when we get there might be helpful to help folks who are faced with this kind of life-altering decision-making, life-altering set of circumstances, cope a little bit better and learn that they're not alone.
Absolutely.
But first, a little bit about Men's Health Network. Men's Health Network has been around for, I guess maybe 27 years. It's the longest and oldest lived organization, not-profit organization that supports and advocates for the health of boys and men where they live, work, play, and pray. We have a number of outreach efforts, including screening programs, which we've had to curtail because of the pandemic, but we're starting to pick that up again. And we do have a lot of information on prostate cancer, as well as overall health things for guys at our website at www.menshealthnetwork.org. We are a member of the Prostate Cancer Coalition, and we have a lot of very good information about this condition on the website, mostly free. And we also have some information there for the women in the guys' lives. Women play an important role in motivating guys, activating guys, sometimes dragging them by the ear into the doctor. But we also have a lot of information that women might find useful in advocating for the men in their lives.
Fantastic. It takes a village, as we all know, to
it does indeed.
Absolutely. Thank you for that overview of Men's Health Network, and we will link to the website in our show notes as well. Did you have a chance to listen to Dr. Penson's podcast episode?
I did. In fact, I know David Pearson quite well. I taught at Belmont University up in Nashville for several years and had the opportunity to work with David while he was over at Vanderbilt, and one of the projects we worked on was a report card on the overall health of men and boys in Tennessee, which has become really an idealized, the icon for what a good state level overview of boys, men, and health should be. And I have a lot of respect for David. One of the things I heard from Dr. Pearson in his presentation was something very important that guys need to understand when they go to a medical encounter, and maybe perhaps we can talk a little about how to select a physician for yourself. But what he focused on was the need to respect a patient's perspective. It's a very important thing in most every aspect of healthcare, but particularly important when you're facing a condition such as prostate cancer, where you're going through the diagnostic rigors of prostate cancer, or the treatment for prostate cancer, or, as in my case, watchful waiting period of prostate cancer. But whether it's cardiovascular health, overall health, I'm a firm believer that the patient's autonomy in communicating with their provider what their views about their quality of life is, what their views about the way they want to be communicated with, what their views about the trade-offs that you have to make in lifestyle treatments as you go through a diagnostic and a management journey. That's terribly important. And Dr. Pearson, I think, emphasized a lot of that in his overview. The other thing that I thought was fascinating is the shift that we've seen as we thankfully, because of the awareness of prostate cancer, that we've gone through, where we get presumptive diagnoses earlier on in the process. So we have many more patients going through watchful waiting rather than, and then catching it at the earliest stage where treatment would bring a meaningful benefit, rather than waiting and just serendipitously or accidentally catching something like prostate cancer or testicular cancer or colon cancer, and then having to engage in really difficult chemotherapies, drug therapies, or radiation therapy. So we're getting people much earlier on, and the watchful waiting periods are much longer. But it also brings us to being able to treat something like prostate cancer much earlier on. And that's terribly important. 97% cure rates or remission rates really can be achieved in prostate cancer if it's caught early. If it's caught late, the remission rates, not quite cures, but the remission rates, we keep the cancer in check, drop down to 50% and less, depending on how long into the disease process it is. So that's another important thing. The other important takeaway from his wonderful presentation was the advances that are being made in the diagnostic skills, and that has direct impingement on my own experience. Just, I think, maybe 2 weeks ago or 3 weeks ago, new criteria or recommendations, if you will, were delivered on the way to go through the diagnostic tree for prostate cancer. We still rely on PSAs, prostate-specific antigen screening, DREs, digital rectal exam procedures, but we're moving away from the biopsies as the next tier to what is a much less invasive or non-invasive procedure, which is MRI radiologic screening. And we can talk about that as well. So I think the other takeaway is that folks need to realize that medicine and clinical management of a patient is as much science as it is art. We are always moving forward. There's always changes, and that's all to the better of folks. So here again, it's important to have a clinician that you respect. And here's my little ditty about how to select a doc that you respect, that will listen to you, that has got 2 ears and 1 mouth, that will take your preferences into consideration as one of the important criteria as to how to develop a treatment regimen, and that you have a good rapport with. You know, all of you who are dads out there and the moms listening, not unusual to go and interview pediatricians, because it's such an important thing. And it's really important to have trust and faith and find a pediatrician that you can talk with, that'll talk well and interact well with you and your child and the dad when they go in for a visit. Same thing for urologic care or any specialty care. When you select a physician or a healthcare provider, make sure you're comfortable with them. When I was working at the DoD clinic at the local Air Force base in the primary care clinic, I was amazed, Molly. I had several patients coming in talking with me more about their encounter with their provider, that they didn't feel comfortable, that they didn't think that the provider was listening to them. They didn't think that the provider was doing the right testing. They didn't think the provider was giving them the right treatments, whatever it was, whether it was something such as prostate cancer or diabetes or just high blood pressure. But then when I looked at the notes and I looked at the clinical records coming over, yeah, everything was fine. There were certainly the right tests done. The therapies were correct. The notes were all in order. The kinds of lab tests that we had there at our disposal were appropriate and correct. But the trick was that they didn't have that rapport. And, I feel so strongly the fact that you have to have that rapport with your treating clinician that I would suggest to patients, find a physician, a nurse practitioner who you really trust and go there. There are a lot of great folks out there, and that rapport is so important, particularly when you're facing something which could be a very long-term management, such as prostate cancer and watchful waiting.
Amen. I can't agree with you more, Dr. Giorgianni. I've actually often joked that when I was interviewing oncologists after my breast cancer, it was almost like figuring out who I was going to date, because I knew this person was going to be a part of my life for many years and I needed to trust and communicate with them accurately. So I think what you've called out is just spot on. Thank you so much for your time, your great response to Dr. Penson's podcast, and for your partnership with Men's Health Network. We are so grateful to have you as a part of our podcast clubs and wish you personally all the best with your health as well.
Well, thank you for having us at the club, and anytime I can be a help to you or your listeners, please feel free to invite us back.
This episode was supported by an award from the Patient-Centered Outcomes Research Institute. This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.